New patient unassigned is intended for groups who have patients that are referred to the practice, but not an individual provider, and equally distributing those patients amongst the providers that can see them so that everyone is getting their equitable share. A lot of times, practices who have many physicians that see the same types of patients are sensitive to the fact that patients who are referred to the practice, but not an individual provider, are not equally distributed amongst the providers that can see those patients. And so sometimes certain providers get more than their fair share. Providers are very well aware to the point that they're looking at their appointment schedule, seeing how many new patients they had for the day, and then comparing that to other providers that see similar types of patients and recognizing that one person got more than they did. In the orthopedic world, if they have a group of doctors and 10 of these doctors see patients with knee injuries, they might have one that they know really specializes in knees and is maybe more proficient and prefers them. And so if they had a patient present themselves with a knee injury, they might be more inclined to schedule the patient with that doctor. Not all doctors in an orthopedic group treat feet, treat spines, do total hips, total knees. And so what we have to do first is figure out, okay, what groups of providers that accept the same types of patients do we need to set and configure against? So all doctors that are willing to see a knee go in this group. All doctors that are willing to see feet go in this group. So we first start with how many different groups do there need to be based upon all the different variants of different body parts that people accept, and then assign providers to those groups. Then we assign a quota so that Opargo can, to some extent, equally distribute one for you, one for you, one for you. But we don't really provide just a one-to-one relationship because first, we want Opargo to be able to use its tools to optimize within the practice. So we set those quotas a little higher so that we can first look at the visit as an individual entity and then optimize what's best for the practice first, and then equally distribute amongst the providers that are within those groups. And so once a tool like this has gone into place, we've seen where schedulers are pushing back on scheduling a certain type of visit with a doctor because they didn't think that they were supposed to. But because this configuration has taken place and it's only presenting them doctors that see knees, they know if it's on the list, this doctor can see knees. Wow, I never would have put a knee patient with that doctor before. I didn't know. So first off, there's an awareness of some scheduler behaviors that we didn't even think were taking place. We're hearing that some of the providers have seen an uptake in their surgery counts, that they're actually performing more surgeries. So it's taking a programmatic approach to apply technology to a problem that people have had for a long time, which is a lot of what Opargo does. We fix the things that doctors know are broken, but they don't know how to fix it.